ilinde Jumuiya Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu. Uzalendo pia mshikamano viwe msingi wa umoja wetu, na tulinde uhuru na amani, mila zetu na desturi zetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu.
Let me thank you, all the people of Uganda who have turned on your radios and tuned in your TVs to yet again listen to the message from His Excellency, the President of the Republic of Uganda, who has asked me to read the message about Ebola to all of you. And His Excellency the President has put it in writing, and I am going to read it verbatim. Fellow countrymen, countrywomen, and foreign residents in Uganda, it is 89 days today since the outbreak of Ebola was declared in Mubende district, and we have been responding to contain this outbreak. It is also 63 days since Mubende and Kasanda have been under restricted movements. On 27th November 2022, I directed Her Excellency the Vice President to extend the 21-day period of restricted movement in Kasanda and Mubende districts as one of the main measures in the control of Ebola outbreak. This was the second time I extended these restrictions, and these measures have slowed down transmission. These measures have slowed down transmission in the two districts of Cassandra, protected the Greater Kampala metropolitan area, and the rest of the country. This has preserved our economy that had suffered as a result of the protracted COVID-19 pandemic, and minimized mortality, which would have been much more had the virus spread further. As I told you at the beginning of this outbreak, Ebola disease, unlike coronavirus, is very easy to deal with, since the methods of spread are through contact with body fluids and infected clothing, and hands are the main vehicle of transmission. This is the reason why I directed Ugandans to stop shaking hands and hugging. Though we have registered great success in the containment of this epidemic, I have been told that we still have 24 days to complete the 42 days, which are 2 incubation cycles. To give us reassurance that the outbreak is under control. So far, Mubende district has not registered any confirmed case for 34 days, and neither has Kasanda for 37 days. The 3,600 trained healthcare workers of different categories will remain on standby. With concerted efforts and through a whole of society approach, we managed to stop further transmission in Kagadi, Bunyangabu, Chegegwa, Masaka, Jinja, Wakiso, and Kampala districts. To date, there is a total of 142 confirmed cases, 56 deaths, and 86 recoveries, which with no more contacts under follow-up. The most affected district was Mubende, which was also the initial epicenter district of this outbreak, with 66 cases and 29 deaths. This was followed by Kasanda district with 49 cases and 21 deaths. Kampala with 18 cases and 3 deaths. Chegegwa with 3 cases and 0 deaths. Jinja district with 1 case and 1 death. There are currently no cases on admission. Therefore, it is against this background that I am lifting all movement restrictions and curfew in Mubende and Kasanda districts with immediate effect. Today, 17th December 2022. The lifting of these restrictions is based on the fact that currently there is no transmission, no contact under follow-up, no patients in isolation facilities, and we are progressing well with the countdown. However, this doesn't mean that the outbreak has ended. We remain on high alert with intense surveillance across the country. In addition to this, all the response structures developed over the past 3 months will remain in place. And this include the 353 bed capacity treatment units in Mubende, Madudu, Mulago, and Entebbe. The Ebola testing mobile laboratory in Mubende district. The 3,600 trained health workers of different categories will remain on standby. The district and community task forces should remain functional. The village health teams in the communities of Mubende and Kasanda districts should continue to sensitize their communities about prevention and identification of individuals with signs and symptoms. Mortality surveillance, i.e., testing of all dead bodies for Ebola in Kasanda, Mubende, Masaka, Jinja, and Kampala districts should continue. This will ensure that no unknown transmission chains are missed. The Ministry of Health should continue to bury all dead bodies in Mubende and Kasanda districts until the 42-day countdown. The Ministry of Health should continue to monitor the Ebola survivors and support them to reintegrate into the community. I have also been informed that there is another ongoing malaria upsurge in the two districts of Mubende and Kasanda. Malaria symptoms resemble those of Ebola. To avoid confusion and possibility of missing an Ebola case, I direct the Ministry of Health to carry out door-to-door mass drug administration of antimalarials or malaria chemoprevention for all age groups. In addition, mosquito nets should be provided to all those communities. These two measures are intended to ensure a reduction of malaria infections in the area. Furthermore, I direct the Ministry of Health to identify malaria interventions across the country to reduce on the burden. And lastly, I want to thank all Ugandans for adhering to my advice and cooperating with the Ministry of Health. Please remain vigilant. Thank you for listening to me. For God and my country. Signed, General Retired Yoweri Kaguta Museveni, President of the Republic of Uganda, dated 17th December 2022.
Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike, umoja wetu ni nguzo yetu, idumu jumuiya yetu. Uzalendo pia mshikamano viwe msingi wa umoja wetu, na tulinde uhuru na amani, mila zetu na desturi zetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike, umoja wetu ni nguzo yetu, idumu jumuiya yetu. Viwandani na hata mashambani, tufanye kazi sote kwa makini, tujitoe kwa hali na mali, tulijenge jumuiya bora. Jumuiya yetu sote tuilinde, tuajibike, idumu jumuiya yetu.
Welcome to Friends Stadium. Everybody's ready.